Hello.
Hello.
Washing my hands. Hi, my name is Carla.
Hi.
I will be your nurse for today, and today we'll be doing an examination from your head to your chest. The examination will probably take about 15 or 20 minutes, and we'll get that done before the doctor comes in to see you. Is that okay?
Yes.
Okay, great. I just need to verify your identity. Can I see your wrist? Can you verify your name for me?
Carmen Anderson,
Thank you, Miss Anderson. And can you tell me your date of birth?
12/24/80.
All right. And Miss Anderson, do you have any allergies?
No, ma'am.
And on a scale from 0 to 10, can you rate your pain for me?
0.
And do you know where you are today?
At the doctor's office.
And do you know why you're here?
For an examination.
And can you tell me what today is?
Sunday.
Okay, so we have 39-year-old Carmen Anderson, who is alert and oriented to person, place, time, and situation. Ms. Anderson was in a hospital or clinical setting. We will make sure that the patient had her privacy, making sure that the door was closed, curtains were pulled, and Ms. Anderson will be dressed in an examination gown, which will be proper attire for examination. So Ms. Anderson appears, her facial features and her mood expressions, it is appropriate for the situation. The patient's speech is clear. She was able to answer my questions without difficulty. She doesn't appear to be in any distress. So Ms. Anderson will go ahead and begin our examination. Go ahead and stick your arms out for me. We're gonna check your skin. We see that the patient's skin, her skin coloring is appropriate to her race. I don't see any wounds, any incisions, or any lesions or signs of infection on her skin, so that's great. I'm gonna go ahead and check your nail beds, and they're nice and pink, which represents normal circulation. And to verify that, we're gonna check your capillary refill by pressing on the nail beds. That cap refill should be 1 to 2 seconds. And Ms. Anderson, we just do this to make sure that the blood is circulating properly. Okay, great. And Ms. Anderson, if you could stick your nails together to me like this. And we're checking the patient's nail bed. I see that she has you can put your nails down. I see that she has a 160-degree nail bed, which represents normal findings, no clubbing of the nail. If you can stick your arms out, I'm gonna go ahead and check your skin temperature. You check the patient's skin temperature bilaterally. Her skin is nice and warm and dry, so that's good. All right, Ms. Anderson, the next thing I'm gonna do is just palpate on your head. Tell me if you feel any pain.
No.
Any tenderness?
No.
Okay. We see that the patient's hair is nice and thick. I don't see any signs of hair loss, no signs of infections, no signs of infestations in her hair. I don't see any lesions or any lumps or bumps. Patient didn't feel any pain upon palpation, so that's good. And we're just going to take a look, Ms. Anderson, next at your facial features. If you remove your glasses for me. Remove your glasses. Okay, and taking a look at the patient's facial features, we see that her eyebrows are symmetrical, her eyes are symmetrical, her face line is symmetrical, no signs of any infections or incisions on her face, which is great. Ms. Anderson, I'm going to go ahead and check your eyes. Okay, we see that looking at Ms. Anderson's eyes, I don't see any redness or any swelling, no drainage coming out of the eye. I'm gonna pull down on your eye and check your conjunctiva, and it's nice and pink and nice and moist. No signs of infection. The sclera is nice and white. All right, and I'm gonna take my pen light, Ms. Anderson, and I'm just gonna check your pupils. You can take a look for me. Okay, great. Great. Okay, great. So Ms. Anderson, pupil size is 4 millimeters bilaterally, which represents normal findings. And Ms. Anderson, you can go ahead and put your glasses on. I just need you to follow this pen light for me. Okay, great. So Ms. Anderson shows no signs of any redness, any swelling or drainage coming from her eyes. Pupil size is 4 milliliters bilaterally. It's normal. Her pupils are equal, round, and reactive to light and accommodation. So we'll go ahead and move to your ears. And I'm just gonna palpate on your ears. Tell me if you feel any pain.
No.
Okay. And checking the ears, I see no swelling or redness, no drainage coming out of the ears, so that's great. Based on the conversation that I'm having with Ms. Anderson, she's not experiencing any hearing loss. She's able to answer my questions and communicate with me. So now we're going to go ahead and take a look at your nose. And we see that the patient's nose is symmetrical to her face. No deformalities of the nose. And I'm going to take my pen light and check your nares. Okay, nose nares are normal. No redness or swelling inside the nose. No signs of any drainage coming out of the nose. Ms. Anderson, if you take your finger and press the side of your nose and take a breath in. Okay, great. And the other side. Nose patency is normal. No difficulty breathing in upon checking the nose patency. Looking at the patient's lips, we see that her lips coloring is appropriate to her race. They're nice and moist. No signs of dehydration or discoloration of the lips. Ms. Anderson, can you stick your tongue out for me?
Mm-hmm.
We see that the tongue is nice and pink and moist. No signs of infection of the tongue. And if you could just open your mouth. Okay, great. Lift your tongue up for me. Okay, inside of the patient's mouth is nice and pink and moist. No signs of infections, no lesions in the mouth. And I'm just gonna check your gums. We see that the gums are nice and pink. No signs of infection on the gums. All right, Ms. Anderson. So the next thing I'm gonna do is just go ahead and listen to your lungs. Before listening to the lungs, we do a general inspection of the anterior of the chest muscle. We see that the patient is not huffing or puffing or gasping for air. She doesn't appear to be in any type of distress. So we'll go ahead and listen to the lungs. We use the diaphragm of the stethoscope to listen to the lungs. All right, just take a deep breath in and out for me. Okay, in and out. We check the patient's lungs bilaterally in a Z pattern, comparing both sides. We wouldn't want the patient to have any clothes on. We would do this on bare skin. Okay, great. And I heard normal breath sounds, no abnormal breathing sounds of the lungs. Ms. Anderson, if you could go ahead and stand up for me. We're going to check the posterior of the lungs. And I'll have you turn this way. We start at the APCs and also using the diaphragm of our stethoscope. Breathe in and out. In and out. Again, you would do this over bare skin. And especially for women, you don't want to auscultate over their bras. Are you feeling okay?
Mm-hmm.
In and out. In and out. In and out. In and out. Okay, and while you're standing right here, I'm just gonna check the lobes of your lungs. Okay, so right upper lobe, left upper lobe, right lower lobe, left lower lobe. Okay, and turn around for me. You want to check the lobes of the anterior chest. So we have right upper lobe, left upper lobe, left upper lobe. The left side only has 2 lobes. So we check the left upper lobe twice, and then we do the right middle lobe, the right lower lobe, and the left lower lobe. All right, Miss Anderson, you can have a seat for me. The next thing we're going to do is check your carotid pulses, located on the side of the trachea, and you want to check those one at a time, comparing both sides bilaterally. Okay, great. And upon palpation of the patient's carotid pulses, I received a 2+ bounding pulse, which represents normal findings. Ms. Anderson, if you go ahead and lie down for me, we're going to check your JVD. So the JVD is the jugular vein distension. And if you could look that way for me, you check the patient's neck lining, make sure that it's flat, no swelling or bulging. And if you look this way, we're going to check the other side. And once again, the patient's neck lining is flat, no swelling or bulging. Okay, you can sit up for me. We check the patient's JVD to, if we found any swelling or any bulging, we would be concerned about heart failure. So the next thing, Ms. Anderson, is we're going to listen to your heart valves, just making sure that those sound normal, starting with the diaphragm of the stethoscope. And you start on the side of the angle of Louis, second intercostal space, aortic valve. And that's right sternum. Then you lift second intercostal space, left sternum, pulmonic valve. Third intercostal space, left sternum, Erb's point. Fifth intercostal space, left sternum. Fifth intercostal space, mid-clavicular line, mitral. Okay, upon auscultating the patient's heart valves, I didn't hear any heart murmurs, no abnormal heart sounds. I heard the normal S1, S2, lub-dub. So I'm going to go ahead and second that and listen to it with the bell of my stethoscope. And I'm listening for low-pitched sounds of the heart valves. So again, starting at the aortic. Pulmonic. And this will also be done over bare skin. Erb's point. Fifth intercostal space. Mitral valve. Okay, and once again, I heard the normal S1, S2 lub-dub sound, no more abnormal heart sounds or murmurs. And I'm going to go ahead and check your radial pulses to your wrist. Okay, and I received 40 beats in 30 seconds. Multiply that by 2, I got 80 beats in a minute. That's a normal finding. And I'll check your other radial pulse. Okay, and I received 42 beats in 30 seconds, which represents 84 beats in a minute. So both of your radial pulses was normal. If for any reason they weren't, I would reassess those for 1 full minute, okay? All right, Miss Anderson, so before I leave, I want to reassess your pain. From 0 to 10, any pain?
0.
Okay, great. Is there anything else I can do for you?
No, ma'am.
Okay, great. And before I leave the patient's side, I will make sure a patient is comfortable in the bed. The bed wheels will lock and at its lowest position, rails pulled up, and the patient would have her call light in case she needs any assistance. We can come service her. Well, Ms. Anderson, the doctor should be in with you shortly. It was a pleasure to meet you.
Thank you.
All right, and you have a good day. Washing my hands.
You too.